Hello, everyone. Hope you're all doing very well indeed. My name is Alex Vaj, and I'm going to try to give an ambitious short presentation, giving you an overview of deliberate practice in psychotherapy. So, telling you about the main principles of deliberate practice, some main research, and how it would apply for psychotherapy. So, let's jump right in. So one good place to start is with this question. Do therapists improve over time? Meaning, do they get more effective as clinicians, helping more people more reliably over time with their years of experience? And the last 40 years of research have really pointed in the direction that therapists do not reliably improve their outcomes over time. Meaning, if you just know the years of experience of the professional, it seems like that's a very poor correlator with how effective they are as therapists. We have here in this graph just one example of this type of research, but there are many studies now accumulated. This is a longitudinal research from Goldberg and colleagues. And what they noticed and what they saw by the end of 18 years collecting outcome data from 170 therapists was that therapists varied very widely in terms of their improvement of outcomes over time. What that means is that some therapists did get more effective over time, others did not. Actually, and I'm sorry to bring in the bad news so early, on average, the therapists seem to get a bit worse, a bit less effective over time. Now, this might seem quite provocative and even shocking for some people, but this kind of research on improving performance over time in therapy actually maps on directly to other professions. Meaning we have a lot of data from other professions where the same result was found. Meaning if you just look at the years of experience of the professional, it seems that that's a poor correlator with how expert they are in that profession. So there's something else that has to happen for people to sustain their performance and increase it over time. So I always joke with my students, these are free psychotherapy research Bibles here on the right. And you can look at each of these and they have kind of a good summary of the last decades of psychotherapy research. And the bottom line is that 5 to 9% of variability in outcomes is due to therapists. The most effective therapists can produce up to 10 times more clinical significant change. What this means is that there are indeed some therapists who much more reliably do help their clients. Now, I have to say that 5 to 9% might seem like a small percentage, but actually it's quite a big variability. The individual therapist predicts better outcomes than whatever model they are using, for example. So if you know the specific therapist, that's probably a better guess in terms of their effectiveness than knowing what model they do of psychotherapy. Now, research has not found, like we were saying before, a correlation or a steady significant correlation between therapists' level of experience or years of experience and their clinical effectiveness. Non-supervised therapists don't seem to differ from supervised therapists in terms of therapy alliance and outcomes. Of course, this kind of research is very hard to do, supervision research, so we always have to take it with a grain of salt. And of course, there are studies showing some differences in alliance and outcomes with supervision. But by and large, we have not been able to find a consistent correlation between supervision practices and therapist's ability to create better alliances and better clinical outcomes. There's some even more provocative research accumulated saying that paraprofessionals with no psychotherapy training can be as clinically effective as trained therapists. So, accumulating all this research, we can say that, of course, therapy can be helpful, and some therapists are indeed extremely helpful in creating well-being and decreasing distress from psychotherapy clients. The problem is really how can we make therapists more effective over time? And it seems that therapy training and supervision still has a long way to go in terms of really helping tailor therapy training and supervision to the individual therapist in a way that really increases expertise over time. So psychotherapy researchers have recently become interested in the concept of deliberate practice, and deliberate practice was a term coined by K. Anders Ericsson in the late 80s, beginning of early 90s, starting to do research on the science of expertise. So these researchers were interested in who are the experts in each field. And we're talking about many different fields that were studied, from chess, music, sports, surgeons, etc. And they really wanted to find what was the difference in those professionals that got steadily better over time. In other words, what principles predicted the development of expertise in different fields over time? Now, what these research found was something very interesting, is that most people, or most professionals, I should say, after a few months or years of practice by themselves without a really sustained disciplined effort to constantly evaluate themselves and get better, they reach what's called arrested development. Now, arrested development is a term to say that most practitioners reach a plateau sometimes rather quickly in terms of how effective they are in their given profession. So, for example, in psychotherapy, we have arrested development just as in any other profession, meaning it's quite easy for us to stagnate, crystallize in our own habits in how to perform therapy, just like any other profession. And in that sense, not actually having an increased performance over time. It's actually quite hard to always get better over time in your given profession. And actually, it depends on the given number of practices that you need to do. They are quite effortful. They take time, motivation, and sometimes, most of the times, external coaching. So it's really an investment to reach expert performance, right? Now, of course, since we're talking about psychotherapy and we do want to help our clients more, we want to try to help therapists get out of this arrested development stage and try to help them reach higher levels of expertise in their given profession by having these tools of how to do better training and supervision. Now, these researchers on the science of expertise coined the term deliberate practice to call a certain methodology of practice, so a certain type of training, which are very specific principles that predicted the development of expertise in different professions. Meaning, across different professions, even if the professions are, of course, totally different from music, sports, psychotherapy, there are some core principles on how one gets better in that profession over time. So the first thing we gotta say is that deliberate practice is not performance. Meaning, if you're just trying to get better over time by performing more, for example, if you're trying to be an expert in basketball by doing more league games, probably you're not gonna reach a level of expertise. Expertise in deliberate practice is something that happens outside of the performance zone. The performance zone is actually a translation of what you've done outside of the performance zone. So what that means is, for psychotherapy, we really shouldn't expect the performance of therapy with real clients to predict getting better over time. And this is actually what we found in the research. So deliberate practice in psychotherapy would have to be a series of practices, of training activities outside of the consulting room, with the purpose of getting systematically better over time in the performance of deliberate practice, of psychotherapy skills. So this is, I would say, the main slide, and these are the core 5 principles of deliberate practice. It's been a way that my colleagues and I, Tony Rusmanieri and others, have tried to summarize this research in a way that is also helpful for therapists. So these 5 core principles are the principles that you want to repeat as much as possible throughout your career in a way to better predict skill development over time. So first we start with observing performance. And this is very important because if you cannot observe your performance, for example, by videotaping your performance and actually seeing it, then you're dependent on self-report. Now, as we know, self-report, unfortunately, is quite a biased process, meaning if you go to your supervisor and just talk about what happened in the therapy session, wishing to get helpful expert feedback, the problem is the things you're going to report in supervision or in training are heavily biased by what you're able to notice during the therapy session, by what you can remember, and a bunch of other things, right? So what this means is that actually for deliberate practice, we need to have objective data of how your actual performance is. We can even joke that 1 minute of observed performance is better than months of self-report. And we actually have a lot of information that therapists self-report, unfortunately, is also not a good correlator of therapy outcomes, which makes sense, right? So again, one important principle to get better over time in any given profession, and we're suggesting including in psychotherapy, would be a systematic observance of therapy performance. And what that would mean would be two things. That would be observing your performance in therapy through videotapes or audio tapes. We hope videotapes would be better, so that you can get expert performance on that observed performance and not just, expert feedback on that observed performance, right? Next, you want to create small learning goals. And this is very important because in psychotherapy, unfortunately, we focus a lot on these broad goals, right? For example, you should have a better therapeutic relationship, which of course makes sense and sounds good, but for the purposes of practice is too broad, too vague. So a deliberate practice coach would help you actually observe your performance, give you very nuanced feedback on what they're seeing that could be actually impeding you from having a better outcome, and then establish collaboratively small learning goals that you could then do through behavior rehearsal exercise, role play, experiential exercise. You could actually train and get better over time, which would be the behavior rehearsal principle here. And you can do behavior rehearsal with videos. You can actually talk to the video. You can do role plays. You can do imagery exercises. The important thing is that deliberate practice is a procedural learning type of training. What that means is that just talking about therapy or thinking about therapy or writing about therapy, while all those things are important and writing papers and doing research is important, to actually get better at the procedural performance skill that therapy is, you then have to actually practice in a performance way. Meaning you have to actually practice as if you're with a client right now, right? So when your coach helps you to establish small learning goals and tailored exercises for your needs, you can actually practice, for example, alliance-focused deliberate practice, where you're training alliance-focused skills, empathy skills, specific skills that you might want to work on, let's say cognitive restructuring, whatever, right? Just having the luxury, the opportunity of repeatedly practicing that skill that you're wanting to get better at. And finally, we're doing ongoing assessment of performance. So your coach will help see if you're actually getting better. Do we need to tailor the exercise to make it more effective for you? And also assessing your performance in the therapy room. So now that you've tried a different thing, tried practicing something, are your outcomes actually getting better in psychotherapy? So again, these were the 5 principles found by the science of expertise and this deliberate practice researchers, and we can map each of these into specific things that could be helpful for psychotherapy. And we're suggesting that this could augment traditional psychotherapy training and supervision. One last principle, and this is really just the last common factor, I'd say, of these principles of deliberate practice, is that deliberate practice should be tailored to the trainee's personal capacity. So what that means is that actually learning happens in the challenging but not overwhelming zone. In other words, and those of you who are familiar with Vygotsky, right, the zone of proximal development, this means that if you're practicing something that's too hard, you're actually not learning. You're just abusing yourself in a way because you're going to feel quite self-critical or frustrated, but you're actually not learning. And if you're practicing something that's too easy, you're also not learning because, again, you're just proving to yourself that you can do something you already know you can do. So a deliberate practice coach, another one of their jobs is really to find consistent exercises and goals for you that are challenging but not overwhelming. So, and this zone is where actually you maximize learning, procedural learning that we're trying to get for therapists. So we can see, like, in a scale from 1 to 10, this deliberate practice sweet spot would be constantly assessing if you're in this good zone from, let's say, a 4 to a 7 or 8, right? And we can actually do this repeatedly throughout practice. So for example, let's imagine that I have a client I have trouble being empathic with. We established a small learning goal with specific criteria that I want to try to practice to say to this client, things that I'm having a difficulty being empathic with. So actually try it out repeatedly, and I'm going to try to stay in a challenging but not overwhelming zone. I'm going to try to be challenging myself in that area that I'm still not so comfortable with. So there's a bunch of recent deliberative practice psychotherapy publications. So you'll see in this table that actually deliberative practice is becoming a hot topic. There's more and more research coming out, and a lot more is about to come out in how to apply these deliberative practice principles for training and supervision of psychotherapists. The good news that we can tell you is that the preliminary results have been quite positive, meaning that deliberate practice versus control groups, and by control groups we mean actually traditional training, more, for example, more didactic, non-experiential, non-procedural type of training. When actually you compare the two types, deliberate practice does demonstrate better observer-rated skill development. Okay. And it has been found, with other research in other fields, that the least effective kind of training is didactic, or, for example, passive listening kind of training, which is a problem in the sense that that's by far the most common that we have in our field. So most people go to workshops and hear the workshop presenter, or go to college or a training program, and most of the time of the training program is dedicated for didactic learning. And while that is important and we're not doing away with it, unfortunately, it's quite limited in terms of actually producing skill development, right? So this is a very important research finding that we suppose we're going to find more and more, is that we're going to have to complement our traditional types of training and supervision with more procedural type of learning, for example, focus on these deliberative practice principles we just talked about. Finally, deliberative practice is hard work. It takes time, it takes sustained effort and motivation, and usually a supportive environment. And what that means is that we really need to create a culture of deliberative practice so that people actually keep doing it. Any of you who have practiced a music instrument or sport know how hard it is sometimes to keep motivated for the effort of continuing practicing scales at home, for example, or practicing any kind of gym exercise repeatedly. And this is one of the core problems, let's say, of deliberative practice, is that it takes time, it takes motivation, it takes effort. And if we really do keep finding that deliberative practice does create better outcomes, or at least better skill development over time for therapists, then we're also going to need solutions for these problems of how do we increase therapists' motivation, how do we create supportive environments for deliberative practice. I'm not going to go too much into it, but I do want to say that there are some very valid concerns also to be addressed by research. So research still needs to address some concerns, and I'm going to point you to this particular recent paper, Improving Therapist Effectiveness, Can Deliberative Practice Help? This recent paper that you can find the citation there at the bottom is a wonderful summary on common concerns on deliberative practice has applied to psychotherapy that research still needs to address. Now, I do just want to end by saying that all the research papers that you saw on that table, and this last one as well that I mentioned, can be found on the Deliberate Practice Institute website. That's dp4therapists.com, dp4therapists.com. And you're going to see on the Resources tab, there's a DP Research and Studies here, sub-tab. And in there, you will find downloadable copies for all deliberative practice for psychotherapy studies that have come out and will come out in the future. We're constantly updating this so that you don't have to. Finally, if you want to actually get a better sense of what actually does it look like to do deliberative practice in psychotherapy, unfortunately, we don't have time today to go into that. I suggest that you also go for the Deliberative Practice Institute. There are a lot of videos on webinars and interviews that will actually give you a glimpse of many resources we've developed to actually promote resources and implementation of deliberative practice in psychotherapy. Just one last note is that my colleague and I, Tony Rosmanieri, have been doing this, co-editing this APA book series that's going to start coming out next year. So we're doing deliberate practice books for the major therapy models, and we're collaborating with major researchers and practitioners in each model to create very specific deliberate practice exercises so that trainees can get systematically better, more effectively in those particular skills over time. This is a very new project, quite ambitious, and I don't believe that there's anything like it out there. And another distinctive feature of this project of this project is that we're constantly testing out the skills we're developing for each book across the world. Meaning the stars you see in this world map are actually the test sites that have tested out different skills for this APA book series we're developing. So the skills are in constant revision so that we can actually find the best way to train these skills across different cultures for different trainees. So what we've learned for the past few years, teaching, researching, and implementing deliberate practice, still very early on, still very preliminary, but just some very short guidelines to give you. To do deliberate practice, you do need to set time aside to do it. You do need to set concrete deliberate practice objectives, and that's where also the deliberate practice coach can really help you really hone in on an objective or goal for you to practice on. You need to constantly assess and adjust exercise difficulty, the challenging but not overwhelming principle, which is totally different, by the way, from most therapy training and supervision, because unfortunately, most training in psychotherapy is not concerned with individualizing training to the individual trainee. It doesn't do difficulty assessment. It doesn't adjust the procedural experiential exercises or role play exercises to that trainee's specific capacity. So we've been developing a lot of technologies to actually be able to constantly tailor the exercise to the particular trainee so that we're always in that challenging but not overwhelming zone so that we can develop skills more effectively over time. Now, repetition is key, meaning for any practice, you have to do it repeatedly to actually gain the benefits from it. There's no use in doing the scale once on the guitar or on the piano, just as there's no use in doing just once an intervention that you're trying to get better at, right? So repetition is key. And again, it takes a bit of time, but it's worth it. If possible, we do really recommend to get a feedback from a coach, a deliberate practice coach, because that's probably the best way to really guide your work in a way that will make practice more effective. So if you have any further inquiries, any further questions, if you want any resources on deliberate practice, there's a lot of free resources we've developed for this website, dp4therapists.com. I really recommend that you check it out. Of course, you can contact me in this email here if you have any questions. And thank you for your time today.